My name is Dr. Kurt Belk, and I'm a board-certified emergency physician and the medical director of the Urgency Room. I want to thank you for choosing us as your healthcare provider. The following video offers follow-up care instructions to your recent visit.
I'm Dr. Waqas Ahmed, a board-certified emergency room physician. During your visit to the urgency room today, your healthcare provider determined that your blood pressure was higher than is recommended. That's why your doctor diagnosed you with hypertension, which is commonly called high blood pressure. Blood pressure is the measurement of the blood pressing against the artery walls as the heart pumps it through your body. High blood pressure is something that many people will have to deal with as they age, and it's a problem that needs to be carefully monitored. There are several causes for high blood pressure. Sometimes a high blood pressure reading is only temporary. If it's related to stress, pain, medication, or other temporary conditions, your blood pressure may return to normal on its own. If you have a history of high blood pressure, you may need to have your doctor adjust your medications. Sometimes a high measurement during your visit to the urgency room may indicate that you've developed high blood pressure that may stay high until it's treated. Sudden, very high blood pressure can cause problems right away, but usually high blood pressure is a culprit for diseases that take months or years to develop. High blood pressure raises the risk for heart disease, stroke, and kidney disease. The very best way to help yourself is to create a healthy lifestyle that keeps blood pressure down. Eat healthy foods, exercise, avoid alcohol, and lower your salt intake. If you're taking medications, take what you've been prescribed. If you're overweight, losing weight can have a dramatic effect on lowering your blood pressure. Do whatever you can to lower and manage stress, and strive to get a good night's sleep every night. Your blood pressure probably was not lowered during your visit to the urgency room because studies have shown that lowering blood pressure too quickly is much more dangerous than leaving it alone. If your urgency room physician gave you blood pressure medications, keep in mind that the medicine may not have an immediate effect. The body and brain determine what blood pressure you have. The medicine's job is to retrain the body's thermostat to a lower blood pressure. It's very important that you follow up with your doctor to see how this medicine is working for you. No matter what treatment you received at the urgency room today, you need to follow up with your doctor in 1 to 3 days to get your blood pressure rechecked. Return to the urgency room if you develop a severe headache, chest pain, shortness of breath, weakness or numbness that affects one part of the body, confusion, vision changes, significant swelling of your legs or eyes, or a reaction to any medication started in the urgency room. High blood pressure is a serious condition which affects 1 in 3 people in the United States, according to the National Institutes of Health. You can do a lot to manage it with a healthy lifestyle. If you have any more concerns, remember that you've got access to board-certified emergency physicians every day of the year, including weekends and holidays at the urgency room.
These videos are intended to provide helpful health information to the general public. They are not intended to be a substitute for professional medical advice. You should not use this information to diagnose or treat health problems, and you should not use these videos in place of a call or visit to a medical professional. Talk with your physician about the proper treatment for your particular condition, and always follow your physician's advice. If you think you need an ambulance or are experiencing a medical emergency, please dial 911 immediately.